there are a couple of different reasons that we look at different vaccines in pregnancy. Some of them are really focused on maternal benefits. So maternal benefit would be decreasing risks of things like severe disease, needing oxygen, hospitalization, ICU admission during pregnancy. Flu is the biggest one that we worry about with this. Flu in pregnancy has the potential for being very dangerous. So getting the flu vaccine as soon as you can early in pregnancy really helps protect mom's health here and helps prevent any maternal outcomes that can be really dangerous if you were to get the flu while you're pregnant. So that does pass some antibodies to baby after birth. So we have about 6 months of flu antibodies, which is the point where baby can be vaccinated on their own at about 6 months old. So that gives some coverage there, but we do not want to wait for this one because of how dangerous flu can be in pregnancy. Tdap and RSV. Tdap is the P stands for pertussis. That's sort of why we give this in pregnancy, or whooping cough. And then RSV is a virus that is very well known because it tends to be the #1 reason that babies end up getting readmitted to the hospital. It's unfortunately very, very dangerous for babies. Neither of those are particularly dangerous for adults. They can be, but they're not as dangerous for adults, including pregnant adults. So we give these both in the 3rd trimester with the goal of building up a good amount of antibodies that pass to baby and give baby coverage for both whooping cough by getting it at 28 weeks and RSV by getting it between 32 and 36 weeks. We get that coverage for baby and decrease the chance that baby gets readmitted with a respiratory disease in those first weeks and months of life when they're very susceptible to pretty significant disease. And then lastly, from a COVID-19 standpoint, I kind of think of this one as both of these things. We know that there are maternal risks of COVID-19 in pregnancy, and there are potential fetal risks of COVID-19 in pregnancy. So giving it when you're due for your booster decreases those risks. We certainly have less information since this disease has only been out for 5 years or so about how this really impacts both maternal and fetal risk, but we do see lower risk with COVID-19 being up to date for both mom and for baby.